third heart sound is 0.1 second. It is produced due to the rapid filling of ventricles. It can be occasionally seen in young adults. The features of third heart sound are it is soft, low pitched. Fourth heart sound. The sound is not heard normally and it is heard best in with the bell piece of stethoscope. It is heard just before first heart sound. It is produced due to the rapid ventricular filling due to the atrial contraction and occurs when atrial pressure is high. Murmurs and bruits. Murmurs are abnormal sounds heard over the heart and produced due to the turbulence created at or near a valve or due to abnormal communication within the heart or between great vessels. The major cause of cardiac murmur are diseases of heart valves. Bruits are common. Bruits are abnormal.